Hi, my name is Misty. I'm a paramedic student with Pierpont. Today we're going to talk about an SVT algorithm. First, you're going to want to assess the clinical condition of your patient, identify and treat any underlying issues, maintain their airway, breathing, and circulation, apply oxygen if hypoxic. If the patient is persistently having issues causing hypertension, altered mental status, signs of shock, chest pain, or acute heart failure, you're going to want to consider synchronized cardioversion. If time allows it, you want to consider sedation because this is very, very painful on the patient. You can also consider adenosine depending on if the patient is stable or unstable. Synchronized cardioversion is if they're unstable. This can be obtained by turning on the sync switch or button, depending on the type of monitor you're using. You're going to want to verify if the machine is detecting the R waves. If not, you may need to reposition your electrodes or pads. If you have a narrow regular complex, you're going to want to cardiovert at 50 to 100 joules. If it's narrow irregular, you're going to want to use 100 to 200 joules. Biphasic or 200 joules is monophasic. If it's wide and irregular, you're going to want to defib. This is not synchronized. To do this, you're going to want to press and hold the discharge button and wait until the machine discharges on the R wave. This is also after you hit the sync button. Common machines, a little white mark will appear above each of the R waves to indicate that it has capture. You're going to want to hit the sync button, then the shock button. A lot of times it will just do it itself. Some machines will automatically turn off the sync button after cardioversion has been delivered. After this, you're going to reassess your patient. You can follow this with adenosine if the cardioversion is not successful. First dose is 6 milligram rapid IV, push with a 20 cc flush. Make sure you have the extremity elevated as well. If needed, a second dose is 12 milligrams IV push if needed, also followed by 20 cc flush. If the patient's stable, you can treat with vagal maneuvers, adenosine, a regular beta blocker or calcium channel blocker, which is follows. Procainamide is an IV medication, it's 20 to 50 milligrams a minute until the arrhythmia is suppressed. Hypotension ensues or the QRS duration is increased by 50% or a max dose of 17 milligrams a kilogram. There is a maintenance infusion of this at 1 to 4 milligrams a minute. You do not want to give this medication if they have a prolonged QT. You can give amiodarone, which is a dose of 150 milligrams over 10 minutes. Repeat if this occurs. You can follow maintenance infusion with 1 milligram a minute for the first 6 hours. Sotalol is also another medication, antidysrhythmic, that can be used. It is a dose of 100 milligrams, which is 1.5 milligrams a kilogram, over 5 minutes. Again, you don't want to use this one either if it has a prolonged QT. You're going to want to reassess your patient every 5 minutes and contact medical command for further treatment and evaluation and transport to your local ER. Thank you.